Assalamu alaikum and welcome back to another episode of What's Up Doc. I'm your host, Dr. Ali Al-Barwani, and I'm a board-certified family physician. My show, What's Up Doc, is a production of Muslim Network TV, the only Muslim-focused network broadcasting in North America. You can watch Muslim Network TV on Roku TV, Fire TV, and Galaxy 19 satellite. I always mess that up. So you can also watch us streaming. You can also watch us as we live stream 24/7 on our website at muslimnetwork.tv and on our YouTube page at youtube.com/Muslim Network TV. Today we have another exciting episode. I know I always say this, and they are always exciting and super informative. Today we're going to be talking about headaches. Headache disorders are a very common disorder. They affect up to half of adults worldwide, and by some estimates, they affect up to 1 billion people worldwide. That's a large number and a very important issue for us to discuss today. Joining us in that discussion is Dr. Ali Saad. Dr. Saad is a graduate from Weill Cornell Medical College in Qatar. He graduated in 2009. He's board certified in neurology and vascular neurology. Since the pandemic, he's been living in Denver, Colorado, and works part-time with a telemedicine company as well as a local hospital seeing patients with neurological emergencies. He also created Stroke Trials, which catalogs and analyzes landmark clinical trials focused on stroke. Stroke Trials is available on the App Store and Google Play Store. Welcome, Dr. Saad.
Thank you for having me, Dr. Al-Barwani.
Of course. Thank you for being here. I'm really excited to talk about headaches, mainly because I see so many patients that come in with that. Mm-hmm. Before we do, I just want to make sure that everyone heard that you created an app. That's really cool.
Yeah, it's something I did during my training. I found it more interesting than doing research as part of my medical training. Mm-hmm. It was great to have just to be able to refer to clinical trials whenever I needed it, and then I figured I'd share it with everyone. And
that's awesome. A lot of really important resources come out of a need that an individual has, whether it's yourself or fulfilling a need for someone else, and then kind of making it available to everybody. That's really smart and really generous of you, actually, because I'm sure you put a lot of time into it. Of course. So today, as I said, we're going to be talking about headaches, and I'm sure you know that it's such a broad topic for us to approach because migraines can be primary, meaning that the headache is in and of itself just there without an underlying cause, or it can be secondary, meaning that there is an underlying cause. Mm-hmm. So before we break that down, I guess if you could just give us a broad idea. I spoke a little bit about how, the incidence, meaning how many people are affected by it. But if you could share with us a little bit more detail about how common it is in your practice and in general as well.
Yeah, of course. And please, if I use any jargon, just let me know immediately and
I will break it down, no problem.
So yeah, of course, headaches are very common. I always thought that everyone had a headache at some point in their life, but I later learned that some people actually have no headaches whatsoever their whole lives. But headaches
are very lucky.
Yeah, they're very lucky people, but they're out there apparently. But yeah, headaches are super common. When we're talking about migraines specifically, they're one of the leading causes of disability worldwide. And about 12% of the population will be affected by migraines at some point. They're more common in women than in men by about 3 times. They happen in children as well. When migraines do happen, they tend to start in people's teens to 20s, sometimes their early 30s. They can happen over the age of 50 and in kids as well, but typically that late adolescence, early adulthood is when you first start seeing them.
12% is a good number. I know you said that there are people who haven't suffered, but out of the ones who are suffering, 12% is a pretty good number. Yeah. And so when we take a step back and talk about the two different, as I mentioned, primary and secondary causes for headaches, migraines would fall into the primary, correct?
Right.
Okay. So let's start there and talk about other types of headaches or primary headaches. And if you can again define for our viewers what we mean when we say that.
Sure. A primary headache is a headache that you just have and there isn't really a dangerous cause underlying it. a dangerous cause I could think of would be like if you had a bleed in your brain, or you had a brain tumor, or you've got some other medical condition that's causing the headache as a side effect. So primary headache disorders are really just the disease in and of itself, whereas a secondary headache is really seeing the headache as a side effect or a symptom of an underlying disease. In terms of primary headache disorders, migraines are certainly one of the most common ones we'll see. Another common one we'll see is tension headache, which are often triggered by stress, and then people will just feel kind of pressure around their head in a band, kind of like a vise, and feel it squeezing. Those are the two most common kinds you'll see, migraine and tension headache.
I definitely have to say that I agree with you. In my practice as well, that is, I mean, obviously if people have migraines and headaches, they're coming to you a lot of the times, but in primary care, I also see quite a few that come in, and I have to agree, I'm seeing a lot of tension headaches and a lot of migraines. When it comes to tension headaches, because I feel like maybe I seem to, at least in primary care, seem to have patients come in with that more than migraine headaches. A lot of the times they're triggered by stress, underlying stress in my patients' lives, or exams, if they're students, or some other thing that they really haven't identified as a reason for the headaches. And so for patients who come in with that, do you usually advise medication, or do you usually advise them to get to the bottom of the reason or the trigger for their headaches? What would you recommend?
Sure. So a lot of people will need both, but I think also a lot of people can get away without using medicines. And one of the first things I like to do when I'm seeing someone with a headache, regardless of what kind of headache it is, often migraine or tension headache, is really empowering the person and telling them, these are the most common triggers for your headache. Let's have you identify these triggers so that you can avoid your headache, or at least get ahead of it when you know it's about to start, and really giving the patient the power to treat themselves and potentially avoid getting on medication altogether, or at least minimizing the amount of medication or number of medications they'll need. The most important things, like you said, stress is number one whether you're talking about tension or migraine headaches. Stress, emotional stressors are the number one thing. And traditionally, the teaching with headache treatment was trigger avoidance. But now we're seeing that really trigger avoidance is not really practical. There's always going to be stressors in your life. And really what people need to learn is how to deal with that stressor and manage it rather than avoiding it altogether. So that's the first key thing. The other things in terms of empowering the patient and reducing headache frequency is focusing on things like diet and exercise, which I feel, at least from what I've seen, doctors aren't emphasizing as much these days. Maybe it's something we take for granted that people really should be doing. They really don't need to be hearing it from us. But I feel that if I don't take the time to emphasize diet and exercise and sleep also, then I'm giving a message that it's not really that important. But I really feel like I need to at least talk about it for 5-10 minutes with the patient and emphasize the importance.
I love that, Dr. Saad. I completely agree with you. I think empowering the patient and having them understand that they do have the capability and the power in their hands to make changes, significant changes to their lifestyle and in the things that they do to really mitigate or change the course of their disease or condition. And I love that you also share that with your patients, because it's true. All of the things that you mentioned are really important. I smiled when you were saying how we're always going to have stress, and that's absolutely true. A lot of the times I tell my patients that, because when we talk about stress, dealing with stress, or kind of getting rid of stress, that doesn't exist. And so learning how to deal with the stress that you have in your life in a healthy way, where you're not having these somatic or body issues like headaches, is really what we're talking about with that. So I appreciate that you share that message. When you mentioned diet and exercise as well as sleep, that's also equally important, of course. And I'm assuming you mean just having a healthy, balanced way of eating, as opposed to eating any particular foods. Or should we be thinking about foods that we should avoid when it comes to migraines, or headaches rather?
Sure. So there's no headache or migraine specific diet. The diet that I advocate for most medical conditions, neurological or otherwise, have two key principles. One is eating food that's mostly coming from plants, and the other is eating food that's mostly non-processed. And I tend to tell people that eating a healthy diet is like being a good person. You can't do it all the time, but the more you do it and the more other people around you do it, the easier it is.
Oh, I love that. That's a really good one, Dr. Saad.
Yeah.
I love that.
Yeah.
And then when it comes to sleep, I know that on average we recommend about 8 hours of sleep. Are you recommending more for people who suffer with headaches or less, or is there a difference with patients with who have headaches?
Yeah, in terms of headache prevention, you don't need more or less than the average person. Adolescents will typically require more sleep, sometimes 9, 10 hours when they're having their growth spurt. And as people get older, they tend to require less sleep. But you don't really need sleep more or less for headache prevention in general. And in addition to getting adequate sleep, I think something we don't focus on enough is the quality of your sleep. So sometimes people will say, yeah, I've been sleeping 8 hours a night, but really they're getting up to urinate. They need to get up and adjust the temperature. They need to get an extra cover. They might have kids or pets in the house that are barking. Their bed partner might be moving around a lot. They might have other medical conditions that are interfering with their sleep, like breathing disorders like sleep apnea, for example, or restless legs. So getting that quality sleep for 6 hours might be more important than getting 9 hours of low quality sleep.
Excellent point, because I am definitely in that boat. You know, I try to get 8 hours of sleep a night, but sometimes I like to have tea before I go to bed. So I'm drinking those fluids, and then getting up several times at night, just like you mentioned. Exactly as you said, you know, or it's too cold or it's too hot. And so I notice that I don't feel refreshed when I wake up in the morning. And so that's another really important point. It's the quality of sleep that makes a difference as well. Now, you mentioned earlier triggers. As far as we talked about emotional stress as being a trigger, something that I tell my patients to do is to keep a headache diary, which if they're not sure what their triggers are, or we want to get a good idea of how often the headaches are happening in order to talk about maybe medication, because which we'll get to, there may need to be on a daily medicine as opposed to just when they have their headaches. How do you feel about headache diaries, and do you have any kind of tips for our viewers as far as keeping track of that?
Yeah, so headache diaries are usually the first step when people are taking control of their headaches, because a lot of the time they can find these triggers or situations where their headaches are starting or being exacerbated, and then they can just mitigate those and avoid having to be on medication. So there are a lot of ways you can do it. You can just get a little journal and just write down when you have your headache, the date and the time, how long it lasted, how bad it was there anything unusual you did that day, did you exercise, what did you eat? So the headache diary doesn't just include your headache, but it's also the activities surrounding your headache. So depending on the kind of person you are, you might find it more useful to actually insert your headache as an event within your calendar. And then when you're looking at the entire week, you can see, okay, what did I do today? Did I go to work? Was I taking care of the kids? Did I go to the gym? How much did I sleep? So in integrating it into a calendar or some kind of app on your phone where you're monitoring certain parameters like your fluid intake, what you're eating, calories, your sleep quality, that actually might be helpful putting all the pieces together and figuring out what sort of circumstances are causing me to have headaches, or at least causing them to happen more frequently than they usually do.
I love it. That's very comprehensive. That's a really comprehensive way of looking at my headaches. And as we said, because there's different things that can affect it, and because when we come to counseling, we talk about all of these different aspects, it's really important to keep track of all of them. So I love that idea of putting it within the calendar of your day. So with that, we're going to take a quick break. You are watching What's Up Doc on Muslim Network TV, and we'll be back after this short break.
Salam alaikum. My name is Adam. You remember me? I appeared in so many episodes that Sound Vision has put on the market. No matter what. Hey, what's happening? Hey, oh, sorry. Lockdown is what it is. Well, continuing here. In this lockdown, Sound Vision never stops thinking about you, the viewer. We'll have to get back into production again, online and inline. Everybody in their own space, even me. Although I'm stuck with Lanisa.
Salam! Salam! Salam!
I know, you were shocked too. Well, let me continue. This is what I was going to say. Salam! 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 Cut! Finally, I get my own screen time again. Thank God. And so we invested in new equipment to bring you even better production with new songs and new singers and animations. Well, here are a few clips. And Sound Vision has brought all this into your home, making Islamic values and teachings easy. And if you know me, Adam, a multi-talented actor, well, sometimes I'm an actor and the reporter and the... Oh, that's enough. Let's move on to the next section. Well, you can watch these new episodes on our new app at www.adamsworldapp.com. We have previews happening every day on Muslim Network TV. Sound Vision has been serving generations, moving and changing with the times. We are all faithfully connected. That is a huge blessing. Your donation helps keep these programs available now and into the future. We take this job of helping tomorrow's Muslims today seriously, and you should too. Today, we need your help. Children absorb and learn from everything they encounter. Make that wholesome, positive, grounded in our faith. Together, we can accomplish our goal of raising better Muslims, better neighbors, and better citizens. Please donate generously. It's an investment in our future. But to finish, let me tell you, there are new scripts of my new mission. And it is something that I enjoy talking about. My new mission is space. Houston, we do not have a problem. Salam, see you soon. Me too.
Welcome back to What's Up, Doc. Welcome back to What's Up Doc on Muslim Network TV. Before the break, we were talking with Dr. Ali Saad, a board-certified neurologist, about the different kinds of headaches, as well as how to keep a headache diary in order to get a little bit more comprehensive information about some triggers and some factors that may be contributing to your headache. Let's switch gears now, Dr. Saad, and talk about what, as you mentioned, is one of the more common types of headaches, and we talked about a little bit earlier, which of primary headaches that is, and that is migraines. I think a lot of people probably have tuned in to talk about that. So let's jump into that, and let's start by describing some of the signs and symptoms of a migraine headache. What would a person who suffers from migraine headaches typically experience?
Right. So yeah, let me start by defining what a migraine is. A lot of people tend to think of a migraine as just a really bad headache, but it's more than that. So I tend to think of a migraine as a headache plus, and so it's a headache plus other things. Those things tend to be things like being very sensitive to sound, being very sensitive to light, having nausea or vomiting, and the headache tends to be on one side of the head, often behind the eye. So it's not just a bad headache. Migraines don't even necessarily have to be super severe. They can just be moderate and in their intensity, but it's got to be accompanied by those features to really be called a migraine. And the reason it's important to distinguish that from a regular headache is that the way migraines happen in your body are different from regular headaches, and they're treated differently.
I'm sorry, Dr. Saad, I missed the last part of that. My internet is acting up today.
Oh, I'm sorry. Okay.
Yeah, me too.
So what part did you get up till?
I heard you describe migraines for us, which is very helpful because, as you mentioned, it's not just a headache. There are particular features of migraines, and so I heard you describe kind of how it was on the one side of the head.
Okay, good. Yeah, so you need to have those features in order to distinguish it from other headaches, because the reason we have migraines is different from the reasons we have other headaches, and the medications we use to treat migraines specifically are often different from regular headaches.
Very good point. I love that you dialed us back a little bit to define migraine headaches, because you're right. A lot of people do confuse it for just a severe headache and calling it that versus some of the symptoms that you mentioned that make it a classic migraine headache. So now that that's kind of, we've laid the groundwork for that, let's talk about we talked about how common it is, but let's talk about the phases of a migraine headache, because as I understand, there are a few phases that person who experiences a migraine headache goes through that may be important to review, because some patients or some of our audience might confuse it for other things that it can mimic. So let's talk about that a little bit.
Yeah, so let's definitely talk about those phases. I know some of them can be scary for people, but often it's just part of the migraine. So it's important to understand that. There are traditionally 4 phases for a migraine. Their names are the prodrome, the aura, the headache, and the postdrome. You may not have all of the phases, but the first one that you'll have is the prodrome, and that typically lasts a day or two, and it'll manifest as kind of non-specific things, mood issues typically. People can be irritable, they might be a little bit sleepy, they might be a little bit depressed, sometimes they'll even be a little bit hyper and happy, and they might have cravings for certain things. And that'll last about a day or two, and then right before the headache starts, they'll get the aura. And the aura will happen right before the headache. Typically, it lasts at least a few minutes, usually half an hour, typically not more than an hour. And the most common symptom people will have in an aura is vision stuff. So they'll either see things that aren't there, or they'll lose part of their vision, which can be very scary. But the important thing to remember with an aura is that an aura totally reverses. Once the aura is gone, you don't have any leftover problems. So the most common thing people will experience with that visual aura is they'll often see some light. It'll be like a sparkling ring of light. And as the aura progresses, it'll start in a part of their vision and just grow and grow and grow and grow, kind of like a C shape or just a circle, and then gradually fade out of their vision. So it can be a bright light, like I was saying. It can also be a part of your vision that's just missing. It can be a hole in your vision that'll grow in the same manner. So it'll migrate. And other auras can be tingling or numbness on one side of the body. You can have weakness in your arm and leg on one side. You can even hallucinate smells. And then once that aura finishes, or often what will happen is as the aura is happening, the headache will start at the same time. And you get the headache. And the headache, like I was saying earlier, it'll typically be throbbing, typically behind your eye, usually on one side. And then after the headache resolves, and that headache will last anywhere from 4 hours to 3 days, typically, looking at the classic definition of migraine. Once that headache is resolved, you'll have a postdrome. And the postdrome is the final phase where people will just feel really drained, fatigued, tired, sometimes irritable. That'll last a day, sometimes 2 days, typically not more than a day.
Wow, that's, going through those 4 phases, that was super clear. And I love how you described that some of those prodrome and aura, actually, I think you had mentioned the aura phase, can be scary for people because, as you mentioned, vision stuff can be scary when that happens. And I have a friend who suffers from migraines, and she'll lose vision, complete vision in her eye. And that, for someone who's experiencing for the first time, of course, that can be scary. But as you mentioned, the main part is that all of that goes away. And as you mentioned, the aura can be, I believe you had said, several hours. And so that's something to keep in mind, correct?
So the aura typically doesn't last more than an hour. It's usually around half an hour. Sometimes an aura can last hours. It's not really typical though. And when that happens, that's actually a red flag. I would be concerned with an aura that lasts a long time. But we will see it sometimes.
That's good to know. And then since you mentioned red flags, let's go down that rabbit hole, because as you mentioned, there are things that we typically see that is normal. And then of course we want to be aware when things are not normal, because it's important to seek medical help when those red flags or scary things that could lead to something more dangerous happen.
Yeah. So typically when I see someone with a headache in the emergency room or in the office, the red flag questions I'll screen with will be things like, is this the worst headache you've ever had? Or if you're someone who has migraines or headaches, some kind of primary headache disorder, is this headache different from your usual migraines? And sometimes people say like it's worse, and I'll say, okay, it's worse, but is the character different? Meaning, usually it feels throbbing. Does it feel different right now? Is it in a different part of your head? Are there other symptoms that come with it? So like I was mentioning, sometimes people will have the aura either right before or during their headache. But if this is your first headache and you have some kind of aura, meaning you're losing vision or you're seeing lights or you're having weakness on one side of the body, unless you've actually been diagnosed with migraine with aura by a doctor, I would consider those aura symptoms to potentially be a red flag, because it might indicate something else. Other things would be a new headache in an older person, like over the age of 50. Like I was saying, migraines tend to start at a younger age. New onset headaches at an older age are a bit of a red flag. Migraines tend to be on one side of the body when they're happening, or one side of the head when they happen, but they do switch sides in between attacks typically. If your headache is always locked to one side of your head, that can be a red flag. Also, if someone has an underlying medical disorder and they start having new headaches, especially if their immune system is compromised by something like cancer, HIV, if they're on immune suppressive drugs for autoimmune problems, that would be a bit of a red flag for me. Also, if they've got some drainage coming out of their ears or their nose, that could indicate an infection, also be a red flag.
Those are really good points, Dr. Saad. Very important points for our audience to keep in mind when they think about their migraines, because as you mentioned, all of those things are linked to more serious things that would have to be addressed and are not typically part of a migraine disorder. Let's move on now, since we've discussed some of the signs and symptoms, some of the things to be aware of or be concerned with. Let's talk about whether there is a genetic component to migraines, because of course, when we take a history, it's important to get family history. And in your experience, how often or how common, if you have some statistics for us, is there a genetic link to migraines?
Sure. So yeah, migraines do have a strong genetic component. According to some studies that have looked at the genetics of migraines specifically, about 50% of what we're saying is the underlying cause of migraines is due to genetic factors.
Wow, that high.
It's really high, and you're 3 times more likely to have migraines if a first-degree relative has migraines. So it does run in families. Typically, people will have a parent with migraine, and we'll see that twins will have it more commonly than they would with just non-twin siblings.
Okay. I also understand, I've read that with respect to, again, higher incidence of migraines, that it's more common, it can be more common in women, and the thought behind that is maybe the hormones, the change in hormones. And so typically women might experience that around when they start to have their periods, so around menarche, and then they tend to maybe improve in menopause when they're older. Do you tend to notice that as well, or can you share a little bit about that if that's correct?
For sure. So migraines are more common in women than men by about 3 times.
3 times, that's high.
It's a big difference. Yeah, and you're right. Migraines do tend to be worse around times of hormonal fluctuation. So during puberty, during periods, and not necessarily during the period itself all the time. Some women will have their migraines worsen right before their periods or right after their periods. Each person's a little bit different. And then certainly when women hit menopause for, around that year when they're starting to have lesser and lesser flow, their body's undergoing hormonal changes, and those fluctuations in estrogen and progesterone, they can also temporarily make their migraines worse. So often I'll see women in their early 50s, late 40s saying, hey, my headaches have been under control for years, or I used to have migraines when I was in my 20s, and now they're coming back. What's going on? And that's one thing that headache diaries actually help with as well, because often women will find that their headaches center around their periods or are somehow related to their periods. And a sometimes easier fix than putting them on a prescription medication is actually putting them on birth control, which will regulate their hormones, and then they won't end up needing other prescription medications.
That is interesting. That's really interesting that we can use birth control that way, but absolutely makes sense if it's related to your hormonal levels changing and there is a clear relationship with periods. Of course, that would make sense. So definitely talk to your doctor and see if that's an option for you if you are female and you notice that pattern as Dr. Saad described. Since we're on the topic of treatment options and we mentioned medications, and of course this goes all with talking about lifestyle changes that we had mentioned earlier, diet, exercise, sleep. Let's talk a little bit about medications, because a lot of times there are so many options over the counter that our patients and our audience probably reach for. Excedrin migraine, I mean, it's in the name, just Tylenol, ibuprofen, etc. There are tons of options over the counter, and that's not always the case or the treatment that's needed. And sometimes it can help, but sometimes it can hurt. So let's dive in a little bit and talk about treatment options when it comes to medications, as well as things that you can do in a neurologist's office to help treat migraine headaches.
Sure. So yeah, often people will feel helpless with their migraines. They'll just say, well, I'm a migraineur, and that's just my life. But there are treatment options out there, and the goal with migraines is not necessarily get rid of them. Usually it's unrealistic for most people to get rid of them completely, but getting them down by 50 or 75% is a very reasonable and achievable goal. So as you were mentioning, lifestyle modifications, they're the number one intervention. Looking at your sleep, the quality of your sleep and the duration, what you're eating. Are you eating regularly? Are you hydrating regularly? Are you exercising regularly? All those things will reduce your the frequency and the severity of your migraines for most people. So that's definitely the first step. The second step would be to have over-the-counter medications and supplements. A lot of people will say, well, I don't want to take medication for migraine, and they may not necessarily need prescription medication. So I will recommend some over-the-counter stuff that's safe and has been shown to be effective. And you would talk to your doctor about whether those would be appropriate options for you based on who you are and your medical problems. But some common supplements I'll recommend would be vitamin B2, magnesium, CoQ10, and feverfew, and vitamin D. Those are usually viable options. And in terms of over-the-counter,
sorry, Dr. Saad, the first one that you'd mentioned was vitamin D2. You had mentioned.
I'm sorry, B2. B as in boy.
B as in boy.
Yeah,
okay.
riboflavin.
Okay. All right.
Yeah.
Thank you.
Vitamin D and vitamin B2. Yeah. Sorry if it sounded like a D. So aside from those supplements, prescription medications, over-the-counter medications you can take would be a category of medicines called NSAIDs, which people are familiar with, things like Aleve, like Motrin or Advil, both ibuprofen, or you can even take combination pills like Excedrin, which will contain an NSAID and then some other drugs. A lot of these combination pills will have a little bit of caffeine or aspirin or Tylenol in them, and those tend to be effective for treating acute migraines. And then if those are ineffective, then we go to step 3, which would be prescription medications. And then sometimes that will include things like Botox injections, but I tend to want to maximize lifestyle modifications and over-the-counters in terms of both supplements and NSAIDs. And if those aren't working, then I'll add a medication on top of that rather than just replace a medicine with everything else, because I want to minimize the amount of medication people will take.
Of course, we want to make sure, because with any medication, and that's something I always tell my patients, with any medication, including Tylenol or ibuprofen, there are side effects, and it may not always be just because we can grab it over the counter doesn't mean that you should be necessarily be taking it. So even with the supplements you mentioned, it's important because some supplements can interact with medications if you are on chronic medications. So before you start any supplements, make sure that you do start, have that conversation with your provider, as Dr. Saad mentioned. And I think it's also an important point to stress as far as how often the migraines are happening, because that does make a difference as far as which arm of therapy your doctor will choose for you. If you're having them once a month, then you might get away with taking some NSAIDs or other medications just acutely when you have the migraines, as opposed to if they're happening pretty often, maybe daily or 3 times a week, that might be something where you would want something preventative. And so I know we didn't talk too much about the preventative or daily type of medications, Dr. Saad, and I know that there are so many, we probably won't get into them. One other comment I want to make is that I would love, not to downplay migraines but to be able to get Botox for a medical reason. Are they in here or?
Yeah, I mean, that's one of the points they'll inject. They'll do it around the temples, on the forehead, behind the head as well. But yeah, I mean, that's a nice bonus you get with Botox injections.
Exactly.
But, a lot of people come in saying they'll want Botox for migraines. A key thing with Botox is that it's not effective for people with acute migraines. You've got to have chronic migraines. And those are the clinical trials that have shown Botox to be efficacious. And Botox is also not a magic bullet. So it'll reduce the number of headaches you'll have per month by like 2 or 3 at most in most people. It's not like you're going to cut out your migraines and cut out your need for medications necessarily. It's really for people who are intolerant to the medications or the medications aren't really doing a good job.
Absolutely. And again, just stressing what you had said earlier is setting realistic goals for the treatment of your migraines. That is something I definitely go over with my patients, because they'll come back, let's say they were having it 4 times a week and suddenly it's once a month, and they're saying, well, I'm still getting it once a month. And I have to kind of dial them back and bring them back to reality and remind them where we came from. And sometimes that's the best that we can do. Such important information, Dr. Saad, that we are talking about here. We have to stop a little bit here to take a short break. You are watching What's Up Doc on Muslim Network TV, and we'll be back in a few minutes.
My wife, she's a professor at the University of Cincinnati, who's Catholic, and by her watching and listening to our 3-year-old son watch Adam's World, she ended up taking Kalima Shahada. She embraced Islam because she learned so much about Islam and the other prophets. It really affected our life in a great way, and because of Sound Vision and Adam's World, we're Muslims.
I took my Shahada 15 years ago, and I actually am from a rural part of Ohio. And so I found the catalog for Sound Vision, and I ordered the tapes and the CDs and the books, and I used those, and especially for my little daughter, that's how we basically learned our Islam, and Islam entered our hearts through the wonderful works of Sound Vision.
Okay, assalamu alaikum, brother. I just want you to know that I love the Sound Vision website, that a lot of times when I'm looking for information, especially as it relates to homelessness, domestic violence, and women issues, I go to that website, and then I see what you've written, and then I copy and paste it, and spread the word, because the wisdom is there, so I can't do any better than what Sound Vision has already done.
Sound Vision is our survival guide. It is the organization that provides skills for Muslims how to survive and thrive in this community here in the US.
Assalamu alaikum, my name is Anam, I'm in 11th grade, and I grew up with Adam's World, and what it taught me was unity, respect, and love for the Muslim Ummah.
Adam's World is the greatest show ever made. Take me to the Kaaba, man. I love that puppet.
Assalamu alaikum.
Open up your eyes.
Assalamu alaikum everyone, it's your brother Zain Bika from South Africa. One of the first educational programs ever produced for Muslim children was the ever popular Adam's World series. The colorful and comical Muslim puppets stole the heart of a generation. Sound Vision will be releasing brand new episodes of Adam's World with the launch of a Adam's World app. Subscribers will enjoy new Adam's World episodes as they are released, as well as all the classic episodes of Adam's World. So visit adamsworldapp.com now to learn more, subscribe, and enjoy new adventures of Adam and his friends. And let's keep helping tomorrow's Muslims today. Assalamu alaikum.
Adam's World. Believe me, there's a lot to see. Bismillah. Let's explore.
Welcome back to What's Up Doc, and I'm your host, Dr. Aalia Al-Barwani. Today we are talking about all things headaches, and joining us is Dr. Ali Saad. And before the break, we were talking about different treatment options for headaches, including Botox, believe it or not. One thing that I was thinking about, Dr. Saad, is when you talked about medications like NSAIDs or non-steroidal anti-inflammatory inflammatory drugs, including ibuprofen, Aleve, and that class of medication, as well as Tylenols. I was thinking about rebound headaches, which I believe would fall under the secondary types of headaches we talked about earlier in this episode, which are headaches caused by an underlying reason. And so can we talk a little bit about secondary headaches, starting with rebound headaches that we can see when patients overuse or abuse these types of over-the-counter medications for the treatment of their headaches? It's very contradictory, but it happens. So let's talk about that.
Yeah, but rebound headaches are very important to be aware of. They're also known as medication overuse headaches. They'll happen with the drugs you mentioned, so it can happen with aspirin, Tylenol, NSAIDs like Motrin, Aleve, Advil. It'll also happen actually most commonly with narcotics or with combination pills. So narcotics meaning things like oxycodone, Vicodin, and combination pills like Excedrin Migraine, or a lot of people are prescribed a medication called Furoset, which is another combination pill. And so those combination pills and narcotics are actually more likely to cause these rebound or medication overuse headaches. And people will have them because they're overtreating their migraines, because their other medications aren't doing a good job, or maybe their migraines are getting worse. And sometimes people don't even have migraines. They just take these medicines for arthritis or some other condition where they're having a lot of pain, and they end up having this medication overuse headache on top of it. And then it's kind of hard to tell, well, if someone has migraines to begin with, do they have a component of medication overuse headache along with their migraines? So one of the things I'll do in anyone who has headache is I'll ask them about the frequency of their over-the-counter medicine use. And really, people are at risk for medication overuse headache if they're taking these drugs as often as every 2 to 3 days. So if someone's taking these over-the-counters, I usually recommend not taking it more than a couple times a week. If you're taking it more than a couple times a week, you're at risk for getting these medication overuse headaches, and people will be scared to stop them. But what I'll tell them is, I know you're scared to stop them because you're afraid your headache's going to get worse, but really you're taking these medicines because your headache is not under control. And really, they're not doing a good job. Otherwise, you wouldn't be taking them. So let's get you off these medicines and get you on a single drug that's going to give you better relief.
Absolutely. I love that you need to really reassure these patients that you're going to be there to help them through this, and that you're not just taking away their blanket, their safety blanket,
right,
which are these over-the-counter medicines. So that's really important to consider if you are experiencing that. Let's move on to other. I know we're running low on time, but most commonly in your practice, when you talk about secondary headaches, I know personally, I don't often get headaches, thank God, but I do have them when I don't sleep well, when I am dehydrated, and especially, of course, during Ramadan, and then when I don't have my coffee, so caffeine withdrawal. So I guess I've kind of covered maybe 3 common ones that you see.
Oh yeah.
Right? I'm sure you see that a lot.
And I have them too, yeah.
Yeah. I think that, I mean, I don't know. I just like you said, when you said earlier, when you said that not everybody gets headaches, I was just like, really? Because I feel like you have to have at least had a dehydration or a caffeine withdrawal. I feel like I guess it's just me and you, but what are some other common causes for secondary headaches that you see that patients should probably, or our audience should kind of think about when they experience their headaches to take into consideration?
Sure. So just to clarify, are you talking about dangerous causes of headache, or just kind of less common things causing benign headaches?
Let's talk about most commonly seen, because that's what our audience will most likely experience. And for things kind of that are uncommon, definitely they would need to seek their medical professional. But for the sake of this discussion, we want to kind of give broad advice as far as when it comes to secondary headaches. What should they be thinking about if they experience maybe certain classic signs of the headache, I guess?
Okay. Yeah. So secondary headaches, whether they're life-threatening or not, just common things that people should be aware of would be if you have a sudden headache that just goes from 0 to 100 in a matter of a couple of seconds, and not something that evolves over a few minutes or hours, and it's the worst headache of your life, that's a big red flag. You could have bleeding in the brain, and that would be a medical emergency. You'd have to call 911 and go to the ER immediately. So sudden onset and goes to maximum intensity within seconds. I'd be worried about bleeding in the brain. Other things to consider, you already mentioned, if you have changed the amount of caffeine you're taking in. So if you decided to cut tea or coffee out of your life completely, or you're just taking less, maybe you're on vacation, you don't have access to the things you usually drink, that would be a common cause. If you start to have vision symptoms with your headache, I would be worried about increased pressure in your spinal fluid. That's something to watch out for if you have recently started steroids, or if you've started a common acne medication called Accutane. Then it can affect your vision and cause headaches. It'll also happen when people gain a lot of weight. I would be concerned. Another thing to consider is if you've gained weight and you've had recent headaches, but you don't have any vision symptoms, you just know you've put on weight for whatever reason, you started to get headaches, and you notice that your sleep isn't restful, I would worry about sleep apnea, which is very common, and it's a condition where you'll have pauses in your breathing at night, or your breathing just isn't really full, healthy inhalations, exhalations, and then it'll eventually become pauses. That's something that can be treated and will reduce your headache, as well as give you better sleep quality.
Absolutely.
Those
are really, really good. I really like that list, because those are things that I also see in primary care. So I feel like with you being a specialist, if you're seeing that and I'm a primary care provider, if I'm also seeing that, then there are probably things that are more common than we would expect or think about. The only thing I would add to that list that I probably see a lot and you probably don't treat is high blood pressure. A lot of times when you have those recurrent headaches, a lot of my patients, while high blood pressure is also called the silent killer, it can also have symptoms. And one of the main symptoms that I have my patients describe are recurrent headaches. So that's the only thing that I would add to that extensive list, Dr. Saad.
Yeah, that's a great point. And you're right, I don't see it, because by the time I see someone with headache as a high blood pressure as a cause of their headache, they usually have additional neurological symptoms with it. So usually people will start having bad headaches from their high blood pressure, but eventually it can lead to them being really sleepy or confused. But certainly just the headache alone can be the first sign, and you want to get ahead of it before it worsens, for sure.
Exactly. And I cannot believe that we have run out of time. I have so many more questions I wanted to get to and wanted to talk about headaches in children as well. So I guess we'll just have to have you back for another episode, Dr. Saad.
I love that. I love talking about this stuff.
That's excellent. Well, it's been a pleasure having you. Thank you again for taking time out of your busy schedule to come and talk with us today. We are so happy to have had this discussion, and we wish you every success in your career, Dr. Saad.
Likewise. Talk to you soon.
You're watching What's Up Doc on Muslim Network TV. Thank you for joining us on today's episode with Dr. Saad, where we talked about headaches. You're watching Muslim Network TV, and I can't wait to see you again on our next episode.